Hello, everybody. This is Gary. Today is Friday, December 13th. Unlucky day today, Friday the 13th. It is 4:24 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia vlog entry for today. Today I wanted to talk about music therapy, and what's called negative symptoms. Negative symptoms in schizophrenia are when something is taken away from the personality and it's taken away by schizophrenia or other psychosis um, that would normally be present in a healthy person. Uh, Negative symptoms mean everything from apathy and no interest in anything. Uh, it's hard to describe what a negative symptom is. Positive and negative symptoms are two forms of symptoms in schizophrenia. Positive symptoms are not good. The word positive is, I think, a poor choice, but that's what they use. A positive symptom is when something is added to somebody's personality that a normal, healthy person wouldn't have, like hallucinations, delusions, paranoia, um, hearing voices, seeing things that aren't there. Those are positive symptoms. Negative symptoms are when something is taken away from the personality that would be there normally in people who are not schizophrenic or psychotic. Um, Enjoyment of life, motivation to do things, everything from work to sex is no longer there. There's no desire for those things. Negative symptoms come across as apathy and boredom. They look like depression, inability to enjoy anything that you used to enjoy. Um, so there's not a whole lot of negative symptoms. There's not a whole lot of motivation to do anything. And those are the most difficult symptoms to treat. When a person takes an antipsychotic medications, they work fairly well for the positive symptoms, reducing hallucinations and delusions and such. But they don't do much for negative symptoms. Um, and I can't give you specific advice about what to do with negative or positive symptoms, but I will talk about my own experience. Um, I have negative symptoms. I often feel a lack of interest in a lot of things, apathetic, not caring about certain things, not wanting to do certain things, um, no drive or ambition or pleasure in anything. Um, so I guess that's the best way I can describe negative symptoms. I'm going to leave a link to the video to Wikipedia, their article on schizophrenia, and particularly negative symptoms, because I think I'm not explaining this very well. But anyways, I wanted to talk about music and negative symptoms with me. I don't play a musical instrument and I don't sing, but music therapy for schizophrenia or any mental illness could involve actually physically playing an instrument or singing. That's the most active way to get involved in music therapy. But for me, since I don't sing and I don't play instruments, I simply listen to music. Um, when people do music therapy, when a therapist has a group for music therapy, or I suppose one-on-one psychotherapy, music is used to motivate people, to get their interest going, um, to get their moods up. Uh, and like I said, I don't play an instrument. I'm certainly not a singer, but I listen to music, and with my negative symptoms, uh, I feel very motivated. I listen to everything from AC/DC to Judas Priest to 10,000 Maniacs. I'm an old school person who listens to music from the 1980s. I know for some of you that's ancient history, and I was born in 1965. But one thing I always found when I was apathetic, not enjoying anything, no interest in doing anything, whether it was work, school, sex, exercise, whatever it might be, I would listen to music. And normally, when I wouldn't do certain things, music motivates me to do those things. I actually have and uplifting in my mood and my motivation to be involved in certain things. If it's work, if it's school, if it's learning Spanish, which is what I try to do. I've been trying to learn Spanish on and off since I was in second grade. Uh, I'm not fluent, but it is something that keeps my interest. And I listen to music before, example, if I study Spanish every day, and I do, I'll listen to music for 15, 20 minutes, half hour, and that gives me more motivation to take up my Spanish lessons, which I get from YouTube. Um, Music just, there's no one part of the human brain that deals with music. There's a speech center for the brain, or the speech center in the brain for speech. There's another part of the brain that deals with vision, called the occipital lobe of the brain, that deals with the sensations of seeing things. There's another part of the brain for hearing things, but there is no part of the brain that deals with music. When a person listens to music or plays an instrument or sings, the whole brain is involved in the process of listening or playing or singing music. The whole brain lights up like a Christmas tree. And for me, that means motivating me to do a lot of things I normally wouldn't be motivated to do. If I'm doing work, I'll listen to AC/DC. If I'm trying to learn Spanish, I'll listen to some soft, quiet music to help me get ready for concentrating on studying Spanish. For me, my negative symptoms are overridden by music. Music lights up my brain, it makes me enjoy things more, have an interest in things more, be motivated to do certain things more. Um, Music is incredibly beneficial for my negative symptoms. It restores ambition, motivation, uh, joy, happiness. Um, it gets my blood up, it gets my blood pressure pounding, my heart pounding, and I really enjoy music. And if you're a person who's psychotic and you don't feel motivated to do anything, try this listening to music, play an instrument, go to music therapy with a therapist. Um, that's the only thing I could really advise. I can't tell you what to do um, about anything because I'm not qualified. I'm not a doctor. So I would say go to a therapist, go to your doctor, go to your psychiatrist, and talk about starting up music therapy. For me, it motivates me to do a lot of different things that I normally wouldn't want to do, um, like clean the house, go for a walk, lift weights, ride my bike, always listening to music through the earphones, and always more motivated when I'm listening to music. Um, but if you could take music therapy with a therapist and actually play an instrument, that actually is supposed to work better than just listening to music. But for me, listening to music is enough to get me to do a lot of different things. Um, in the music type, I don't think necessarily matters when you're just listening to music. It's whatever you enjoy. Um, I saw a video on YouTube once when there was a 2-year-old boy in a high chair. Now, he doesn't even speak yet, and he certainly can't sing. Um, but when they turned on music in the video near the baby started dancing. We're talking about a 2-year-old. Um, Music seems to be hardwired into our brains through evolution in a way that other animals don't have. So music can be a powerful force. If a 2-year-old recognizes music and actually dances to it spontaneously, then there's something about music that motivates humanity in general. And I would strongly suggest that you learn to play an instrument, go to music therapy, listen to the music you enjoy. Um, and music, by the way, can also help be some way to distract yourself from, say, auditory hallucinations. If you're hearing voices, that kind of thing, try drowning it out with some music in earphones. Just even if it's just for a little while, concentrate on the music instead of the voices. That's what I do. So I guess I am giving advice here, but ultimately you have to talk to a professional, your therapist, your doctor, your psychiatrist about music and music therapy. Of course, you don't need a psychiatrist to turn on the radio or turn on YouTube. and go to your favorite music videos. So give music a try in some aspect, in some respect, when you're dealing with your schizophrenia. Like, subscribe, comment, share. If you have an idea for a video you want me to do, leave it in the comments section. If you have questions about mental illness or any other topic, just give me a suggestion in the comment section.